Hi, everybody. Thank you for joining this morning. Good morning. I hope you're well, safe, and taking a good care of yourself. We had a wonderful conversation about uh, colorectal cancer, but today I just want to talk about something so important, which is cervical cancer. Cervical cancer has been categorized as AIDS related malignancy, and it does not mean that if you have cervical cancer, then it's an AIDS defining condition for you. But it has been observed that so many women are now presenting with a cervical cancer when they're HIV positive. And it has been noted that uh, cervical cancer has been seen to grow faster in the presence uh, of HIV. So when the patient has been infected with HIV, they tend to present with cervical cancer quite early. So these are things that are really key and very important that we should note, remember, and don't ignore. Cervical cancer previously was defined as the disease of the older women above 40. But we see the changes in the lifestyle that we live in present. Young people are starting to present with cervical cancer at a very early age. The American College of Obstetrics and Gynecology have already also changed their guidelines where they say um, it is important to screen at the age of 21, which is very appreciated. But they do say there's no data to support this change. But I'm glad that it has been covered by a society that deals with obstetrics and gynecology issues. So this helps the clinicians on the ground to be able to help you, to help the community uh, on on early detection. Because my main cry is that can we detect these diseases early so that we can save our people's lives? I remember when I went for a mammogram, I was told I'm too young. I was denied. I had to really submit motivations why I want to have a mammogram because I had lumps in my breast and I wanted them checked. So these guidelines sometimes have a tendency to hinder patients from accessing healthcare. But what I'm happy about cervical cancer is that the guidelines have assisted us in being able to screen the patients early. And people who do the screening sometimes cannot do it because you will not be covered if they do it. So, cervical cancer is a very important topic. It's a very important discussion that we should actually go into details in discussing it. But for this session, it's just to help you being able to recognize the signs, the symptoms, and then start dealing with the issues early. But specifically, this talk was meant to highlight the abuse of women and abuse of patients by the doctors when patients come to our centers. So I'm going to touch briefly on cervical cancer and I'm going to have a very in-depth topic and conversation on cervical cancer with you. But today, because it's August, last day of August, and it's the day that is very important to my country, which is August is a very special month where we celebrate women and women who with their struggle and women and we face women's challenges and we deal with women's challenges. Why August? Because August in 1956, the women of South Africa walked against the past laws. They walked to address Verwoerd, who was the prime minister at that time. And the aim for this march was to demand that the past laws be removed because Black people had to show a pass wherever they go. You could not go do groceries in town without the pass. You could not enter places, the restrooms were different for the whites and for the blacks. So we suffered a lot. But you know what was amazing about South African women is that they united. There was no black, there was no white. Sometimes people don't understand as South Africans as to why we deal with the racism, we don't deal with the skin color. We deal with tribalism, we deal with discrimination because we have been helped during apartheid by some white people who came and rescued us and supported us. For instance, then Nelson Mandela's lawyer was a white. So if you have a problem with the skin color, that's your problem. We have a problem with the actions, which is racism, hate, oppression. So this tribute is the tribute of the women with cervical cancer, the women I have seen, the women I have helped, the women whose life has really impacted the change in the management of cervical cancer in the clinics that I've worked in. So this tribute is mainly for cervical cancer patients that I've seen, and I will tell you the details of why I'm doing this. And when you see this live, you will realize it was important for us to discuss the management of cervical cancer patients and go into details as to why do we treat patients in a different way and why do we as doctors sometimes fail to respect our patients. So cervical cancer is a disease of the females, obviously, because they have a cervix. And cervical cancer takes place different forms. What happens is you do a pap smear, a test called a pap smear, where they put a speculum, something called a speculum, inside you vaginally, and then the speculum will come out with the results, and those results will then tell us whether is this carcinoma, which is a cancer, or maybe it is a carcinoma in situ, which means it is a pre-cancerous lesion just before it becomes cancer, or maybe it is CIN. CIN, the CIN1, CIN2, CIN3. This is a pre-cancerous lesion. This is where we see the abnormality on your pap smear, but it has not become a disease at that time. It has not become cancerous. Why am I talking about the pap smear results? Is because I just want to show you how much time you have to be able to deal with cervical cancer before it even becomes cancer. Before you even get the diagnosis of cancer, the CIN1, the CIN2, the CIN3, this carcinoma in situ. These are 4 stages that cervical cancer goes through before it becomes a cancer stage 1, cancer stage 2, cancer stage 3A, cancer stage 3B, stage 4A, and stage 4B. Do you see? There's 10 steps, 10 stages that cervical cancer goes through before it becomes there's 4 stages that cancer goes through before cervical cancer goes through before it becomes cancerous. So there's 4 stages. If you have been diagnosed with stage 3 cancer, it means you've gone through almost 8 stages and you missed them all. Do you see why now I am so passionate about using this knowledge to help you understand and save your life? It's because I know it can be prevented. I was diagnosed with CIN2 when I was in medical school during my cervical cancer screening. Imagine if I did not do that screening, I would be dead today. Do you understand what I'm trying to lay down as a foundation for our healthcare? Is that we have to screen early. This is why I started done at a very clinic that is packed. Patients will be sent back. There are some patients who would come and complain that they are being sent back home because they are told their vagina is smelling. They've been in the clinic from 3 a.m. because some patients are waiting for a very long time. There are many challenges that are blocking women from doing screening. We understand the knowledge ourselves and present ourselves to the centers. If I did not have a knowledge, I too would have missed the screening. If I was also in your shoes without the medical skills, I would have missed it. So, what I'm trying to say is if your family member has cervical cancer, you must go too. It doesn't even have to be a family member. If you have not done your pap smear, you have to go and get it done. It's a must for every female. If you have not had a prostate cancer screening, it's a must for every male that you must do your PEPs, your prostate cancer screening. Somebody has to check your body. If you have not had your breast examined, now is the time, and it's very important that we prevent ourselves from dying from diseases that are so easily preventable. Now, cervical cancer, when you do this pap smear, it comes back and tell your OBGYN, is it obstetrics and gynecology, the obstetrician or the gynecologist who tested you, or a general practitioner or primary physician. This is what it tells them. Spatula or any ways of screening that is available to take that mucus area around your cervix. Some of you, when we put the equipment to screen and we check, we can see the cervix through the speculum and how it looks. Some are friable, almost whitish in color. Some are bleeding red in color. There's so many different kinds of cervix that we see when we view your cervix through the speculum. I want to say, yes, I know it's painful. I understand most women use that as an excuse not to screen. So you would rather sacrifice your life for the pain that takes only 15 minutes. You'd rather die and lose your whole life, leave your family and children behind as orphans just because you don't want to scream, you don't want to feel the pain. And this pain, which is just so minimal, it's not even like childbirth. If you've had a child and you don't want to have a pap smear, I do not understand, because pap smear is going to save your life. Now, with the stage, with all the CIN 1, 2, 3, you can do a test, a simple scraping test, simple scraping treatment, which is called colposcopy. You go lie down, they put a dye to see the cells that are abnormal. This is done by by a gynecologist. Then they will take a scraping machine. Then they scrape the abnormal cells out. This is what I had. I had a colposcopy because I presented very early when I was in medical school. I did my screening. They found that it was abnormal, and I went for colposcopy, and it was done. Mine was done at King Edward Hospital in Durban, South Africa, and I appreciate this hospital for saving my life. But I had to go early and report to the doctors. And this was offered in medical school, and I appreciate my medical school, which is Nelson Mandela School of Medicine at UKZN in South Africa, for being able to provide us as medical students free healthcare. So we were getting free healthcare. So, by being able to do the screening, I managed to save my life for you to be able to have me today sharing with you this information. I'm sharing this information, which is a very private medical diagnosis of mine, with you so that you can realize that it is possible to live even when you've been diagnosed with cervical cancer, or even when you've been diagnosed with pre-malignant lesion, which may predispose you to cervical cancer. So when you have CIN, like we said, the CIN 1, CIN 2, CIN 3, and CIN 4, These are pre-malignant lesions. They are not malignancy. This is why we ask you to do a pap smear so that we can pick it up early. So if we pick it up early, you get this test, this treatment called colposcopy. It is done without anesthesia. You just get a local anesthesia. You don't need to be in a theater room. You also don't need to be admitted. It's an outpatient procedure. It also takes about an hour at most, but the waiting, obviously, you have to come and do all the preparations that is required, but it's just an hour procedure. And then you have to follow up with the pap smears every 3 months, every 6 months, then every year, depending on the outcome of the results that the doctors found after they then are removed. If they follow up, they found that there's still some residual cells, they will take some other steps. But the CIN is what I wish that we all detect in our community. So if you go early and you get screened quite early, we will pick up the CIN and will be able to help you prevent this disease. Now, carcinoma in situ is a pre-malignant lesion that you will be referred for further management. Cancer, when we then diagnose cancer, it's a cancer of the cervix specifically. Then, when we say it's stage 1, it's different than the colon cancer. Remember that we spoke about colon cancer, and I mentioned that with colon cancer, there's something called TNM staging, which is T for a tumor size, N, which is lymph node, M, which is metastasis, T, the tumor size, how big it is, and we look at the centimeters of the tumor, and that's we can then categorize it as whether is it T1 to T4. So if you then find the node, then we have to categorize the node whether it's node 1, 2, 3, or 4, or what kind of nodes, how many nodes, are being found. Is it 1 node, 2 nodes, 3 nodes? And then when you find these lymph nodes, you have to say how many were removed and how many were positive. That is very important information that we need in order to be able to decide on the treatment plan. Without this information, it's difficult to treat. So, but there's a difference with cervical cancer. We do not use the TNM staging for cervical cancer, but doctors use their own clinical, it's a clinical staging. What do I mean by clinical staging? I mean, a doctor will then go put the finger, use the finger to assess your cervix. So it's a vaginal examination they do and perform. And in that vaginal examination, the doctor will be able to say what is the outcome based on the finger. So yes, it is the finger is well trained. Don't doubt it. But yes, it depends on who is examining you. It depends on the skills of those hands and how many. If you're being examined by a medical student, you still need someone senior to check, because it happens in some clinic where there's training in Africa, they don't have resources. Medical students do sometimes assist in this screening, but they have to be supervised by someone senior so that that person who's senior can then use their hands to feel your cervix and be able to tell the staging. There's so much about the staging that I will not go through in details, unless if maybe I'm talking in the house field with medical students, where we'll be able to discuss in details what is the cervical cancer staging, what does it entail. Now, the staging for cervical cancer is a clinical staging. It's called FIGO staging. You take your hand and put it in the cervix and then determine whether it's stage 1, stage 2, stage 3, stage 4, stage 4A, stage 4B, depending on how the structure and the spread of the cancer on the parametrium. There's so much that is involved in being able to review where do you stand with the cancer, where does your cancer stand with your within your cervix. So when we find out the staging, then you get sent either to a surgeon, which is going to be a gynecologist, not an obstetrician. Remember, an obstetrician is a doctor who deliver your babies, but a gynecologist is a doctor who deals with the illnesses that involves the female organs. So you'll be sent to a gynecologist. Where I come from in KwaZulu Natal, South Africa, there was only one gynecologist for the whole province. Can you imagine the waiting list that was there and the waiting period? So most of the patients were diagnosed with stage one. By the time they get to him, they already stage three. They have not even got to the level of seeing an oncologist at that time. They're still stuck within the gynecologist. So I'm speaking now to the implementers, policymakers, and leaders. Sometimes you are the cause why we are seeing an advanced stage. Our leaders sometimes they don't improve the systems to help you save your life. The delays are unnecessary because by the time the patient comes to an obstetric to an oncologist after being delayed from the gynecologist, the scans that were done are already old. By the time the patient will come to me, I will then have to ask for new scans. And then the waiting period for those scans was another 3 months, 2 months. It takes forever for patients waiting. And what happens to your body at that time? The cancer is growing. Another reason why you should go early, because you don't want to be stuck in the mess within the hospitals. You don't want to be in that whole mess of delays, of challenges. Just do your things early and make sure your treatment is found, your disease is found early and can be treated early. So when you go to an OBGYN, when you go to a gynecologist, the gynecologist will decide whether he's operating or and what type of operation is he going to do. We'll dwell into details on the surgical component later on, but just know you will be sent to a surgeon. Now, I want to address my a black brown community when it comes to surgery. We are scared of surgery and we consider surgery as an abnormal or as a scary thing. Some people were saying, oh, you won't come out, we don't go for surgery. I just want to reassure you that when your doctor says we're going to operate, that is actually good news because that cancer will be removed from your body forever. So it gets removed depending on whether they can get the full clearance. The margin of clearance is very important. With each cancer, we look for a margin of clearance. It means that area of trauma, of tissue without the tumor or the cancerous lesions or the cancerous cells is key. We measure it. If the measurement is good, then we consider that cancer gone, removed. Then you will need radiation, which is a local treatment to that area. If that kind of tissue radiobiologically responds to the the kind of radiation that we plan to give you. Now, staging is key because that's what tells us where you should go, what we should do. Say you've done your surgery and then you get referred to an oncologist. An oncologist will then review the surgical results. They will review your pap smear results. They will review your CT scan, your chest x ray, your bloods. Remember, even if you have everything working well for you, but if your blood results are abnormal, we cannot start radiation and chemotherapy because your blood results tells us the status of your body. This is not looking for blood results for HIV or anything. No, there's no exclusion based on your HIV results. But these are the blood results where we look at the function of the kidney, we look at We'll look at the function of your blood and the bone marrow. Is it producing enough full blood, the white cells, the red blood cells, and the platelets? We looked at all the electrolytes in your kidneys. Are your kidneys functioning well? If your kidneys cannot function well, you cannot be able to access the treatment because it's gonna damage your kidneys even more. If your blood is not strong, your body is not strong to receive the treatment, you will have to first go, and you understand how much delay that is. It causes even further delay. So I'm still emphasizing the importance of early detection, that it will save your life. When you hear me or see me commenting early detection save your life, I really mean exactly this, that because of our late detection, we may cause a problem for ourselves in a very long run because the system work in a different way than what we need and expect. There's delay, you have to wait, things don't go just like that. Just because it's an emergency in your side, then it has to be an emergency for everyone. So it frustrates a lot of patients to wait in queues, to wait for results, to wait for their date, but that's how it is. There are so many patients who are coming up who are developing cervical cancer, and the numbers are rising. Now, you go to the doctor, they look at you, they look at your performance status. Let's say everything is fine, it's perfect. We are ready to start. We cannot start without your consent. You have to consent that you want this test done, you want this treatment done. Without your consent, no doctor can give you a treatment. Sometimes there's been patients who qualify for everything and they say, I'm sorry, I do not want you to treat me. I'm not agreeing to chemotherapy. I'm not agreeing to radiation. And I don't want anybody touching me. I don't want admission. I may have the best solution. I may have the best treatment for you, but if you don't want it, nobody can force you to have it. So now the important part is that you should know the symptoms. If you feel discomfort in your lower abdomen, you get pain during sexual activities. If you have profuse bleeding or you have abnormal menstrual cycle, or maybe you may have stopped bleeding because of menopause, and you're an elderly patient who starts to feel the bleed coming out, and you're starting to use the pads after your periods had stopped for a certain number of years and it's coming back. If there's any pain, there's abnormal discharge that is smelly, or even if it's not smelly, but usually it's a smelly discharge. Any discharge you see, thick, abnormal, different color, white, yellow, green, you have to report it to your doctor. It is very important that you take care of yourself and make sure that you are well. You have to make sure that you are well. I'm talking about the symptoms, but I want to emphasize this. You do not have to wait for the symptoms to go do your pap smear. Can I say this again? It will be a bad decision for you to ask me what are the symptoms so that you can wait to see the symptoms before you do something. This is why I'm taking my time to share this with you so that you realize the most important thing is for you to go and check yourself now while you are well before you develop the symptoms. Because when you start developing the symptoms, you must realize the problem is already existing. There is already something going on in your body. There's a very important virus that I want to share with you. It's called human papillomavirus. Shortly, we call it HPV. HPV is a virus which is the main culprit that predisposes you to developing cervical cancer. This virus is increasing the chances of the metaplasia. What is metaplasia? Is a change of a normal squamous cell into a columnar or a different kind of tissue lining. What happens is your cervix has a normal cells. The HPV tends to change that and give it a different picture. So what it does is it makes the tissue of your cervix grow into abnormal shape, abnormal size. This is when we pick it up on the pap smear, that abnormality. This is what the pathologist will look for. So the human papillomavirus, which is HPV, is a main culprit for developing this kind of a disease. But also, women are well known to be putting things in their vagina. Leave your vagina alone. Stop shoving things in your vagina. Okay, there are things that are, are natural, like washing. Wash with water, clean water. Wash yourself, your body, and make yourself clean. It's enough. The vaginal douching that we do as women is a scary issue because we are introducing the external abnormal things into our bodies. I'll make an example. Once I was doing a cervical cancer examination on a patient, and I found, basically, let me just briefly say, I worked in obstetrics and gynecology before, when I was waiting for my oncology rotation, because my professor, obviously, he didn't want black people. So the waiting was very long because I was of a wrong skin color in his department. So I wasn't allowed to train in oncology. They kept me waiting forever. While I was waiting, I waited as a medical officer at King Edward Hospital, where I was working in obstetrics and gynecology. So I did a lot of vaginal examination. I also worked in a gynae section under the supervision of the only gynecologist who was at King Edward at that time. And during this vaginal examination, when I was working in room one, I think it was called room one in South Africa, I realized that uh, when we were doing examination, I put my finger and found the garlic in a woman's vagina. Yes, there was garlic, the clove of garlic. We've put in our hands and black stuff will come out. Sometimes we put in your hand, uh, I heard some cultures put soil in the vagina. If you didn't know this, Google it, you will see it. There are many challenges, many challenges we face with women and their health. Now, we have to stop this because we are causing our own problem. Sometimes we develop cervix because of the things that we insert in our vaginal opening that are not supposed to be there. And we constantly put things in our body as a way. Sometimes some women, I did interview some students who were using even snuff in the vagina area. They say it helps them uh, uh, accentuate the sexual activity and it helps the men enjoy them more. Are you really going to sacrifice your life just for a moment of pleasure? And there's this notion I would like to also address amongst the African men, or I don't know, some men, maybe not to be specific, that a woman, when the woman is wet, is a bad thing. So women tend to shove all the do vaginal douching and shove everything in the vagina because they're trying to make themselves dry. There are some countries which believes that if a woman is wet, it's a sign of being promiscuous or it makes the sex so disgusting, as they say. I just want to say to you, my brother, you don't know anatomy and you don't know physiology, and you cannot be the God and make women change how they are created. When a woman is aroused, she will produce the fluid. It is normal. It's because of the hormones, estrogen and progesterone, and all other hormones that are involved in the sexual activity. If you are asking her not to secrete any fluid, then you are making her an abnormal, you're making her an equipment that is designed for your own sexual pleasure in your own crazy way. You need to really go and learn your body and the body of a woman. You need to understand and study a woman of a body so that you, when you next time you make certain comments, they're not going to be heartbreaking for women. You realize that you are making a mistake because you have to go out of your way, sacrifice yourself, your health for a man. That man does not love you. If your men criticize you sexually just because of your physical structure and the way God created you, there's another man for you who will appreciate you. Pack your bags and leave before you die. If you have to put the sand, newspapers, clothing, everything in your vagina, garlic, everything that you have to shove in your vagina just for sexual pleasure, you are in a wrong relationship. When I worked in obstetrics and gynecology, there was a patient. This was many years ago. I think it was 2007, even before like 2000. It was 2007, 2008 when I worked in obstetrics and gynae. Uh, there was a lady who came with a huge wadi lesion, huge, like I couldn't even put the finger in the vagina to be able to access. Then I asked her, I said, ma'am, but this is smelling, it's oozing, it's been staying there for a very long time. Why are you keeping your warts? She said, if don't you know, doctor, that the warts, the men love the warty lesions because the warts make sex even more delightful for a man. I paused because I cannot believe the things we do to ourselves. I cannot believe the myths that we believe when it comes to sexual activities. And I'm emphasizing this because you are destroying your own life. You are the reason that is going to come back with medical problems because of your beliefs when it comes to sexual activity. You know, the sexual organs suffer so much because people will do anything to be sexually pleasurable. And you don't realize that sexual pleasure is all, sometimes half of it, a mental issue. It has nothing to do with you as a person. It has a lot with the person's state of mind about you. So you can shove and put anything, and the person will still leave you and will still complain. But when I saw this woman with the Wati lesion, I started getting worried that there's something we need to do in our community. These are the things that have made, I've heard in the clinic, that made me come out and educate. Educate you at the comfort of your home, educate you at this time. You can play this video, like, subscribe, join, share, comment. Make sure that you make use of this information. If you subscribe to this channel, or you'll be able to get more information and more support as the time goes on. And when I go live,